Hello, my name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm talking to Leanne Medor, an NMC nurse who has worked as a patient navigator for the Northwestern Orthopaedic and Rehabilitation Center. So welcome, Leanne.
Thank you, Jill.
It's a pleasure having you here and learning about what's new, at Northwestern Medical Center. And particularly today, we're going to talk about orthopedics.
Yes.
Perfect. So since I think this is your first time on the show, notice I said first time, that means you likely will be back, right? Because you're going to have great information.
Absolutely.
Okay.
I hope so.
So tell our viewers a little bit about who you are and, how you became a nurse.
Okay, so I've been a nurse for 16 and a half years. I went to Vermont Technical College, and then I started my career at Northwestern Medical Center November 2001. I started off as an LPN. I worked as an LPN for 3 years as I worked towards my RN on the medical surgical unit. So I used to take care of the patients that were on the floor, and then I transitioned into the charge nurse role for about 7 years.
Right. So what type of patients do you see on a medical surgical unit?
On a medical surgical unit, we see anybody who's had belly surgeries, total joint surgeries, any medical issues such as pneumonia, congestive heart failure, so a whole variety of patients.
So what is a nurse navigator?
So a nurse navigator is a nurse who has a group of patients that they follow. The group of patients that I follow are our total joint patients, so anybody who's having a total hip, total knee, or total shoulder replacement.
Okay. All right. And so what does the patient experience with you?
So I end up being the patient's direct contact person. So I meet them in the office after they talk with the surgeon, and I follow them throughout their entire care with their total joint surgery. So usually I keep in contact with patients for a year.
Wow. So you pick the patient up, so the patient comes to the surgeon.
Yep.
And then maybe walk us through what a patient would experience, the different steps that you
absolutely.
take them on.
So a patient will come in and they will meet with one of the surgeons. And if they decide to have a total joint replacement, they come and get me. I have a total joint binder that I hand out to all of our patients. And then right there in the office, we discuss what day is going to be good for them to have surgery. We do try to accommodate around people's schedules. So we set a surgical date, and then we start talking to them about the process, what's going to be required before surgery, what to expect during surgery, and our expectations for after surgery.
So what happens, do you have classes for folks before they have their surgery? How do you prepare them?
So we have a total joint class that we have all of our patients attend, and that's about 10 to 11 days before surgery. A lot of stuff happens at this class. We do all of our pre-op testing at the class, so they're able to go in and do their labs, their EKG. They get to meet with an anesthesiologist and go over all of their different anesthetic options. They get to talk about what has or hasn't worked for them in the past. And then we do our class where we talk to them about what exactly to expect on the day of surgery. We talk to them about equipment that they're going to be seeing in the hospital, equipment that they're going to be seeing at home and using at home. Lots of good information. We go over precautions and exercises. A lot of the patients who come in feeling nervous beforehand put at ease at the end of their class.
Nice, nice. So what is the day of surgery like for a patient that's having a total joint?
Absolutely. So the day of surgery, a patient will go down to our surgical services and they get walked through our ambulatory surgery, so they get prepared for surgery. After they do go into surgery, they go to our recovery room, and then they get to go to our progressive care unit and stay usually one night.
Oh. Wow, that's changed, hasn't it?
Absolutely.
Over the, 16 years?
Over the 16 years.
What have you seen for changes in that?
So we used to have patients that would stay 3 to 4 nights, and the majority of them at the time would go to our rehabilitation center. So now patients stay one night. And if they actually have a partial knee replacement, we can even try to get them home the day of surgery.
Wow. And so what is needed in that preparation from that 3 to 4 days now to that one? What's different now?
A lot of education and preparation for the patient. So also while they're in the office on the day that they discuss having surgery with the physician, we start their discharge planning right then and there. We review with them what our expectations are, which is as long as they have good pain control, they're able to get in and out of bed, they're able to go home the next day. And then we talk about what their home situation is.
Yeah, okay.
We make sure that they have a good support system at home, that they have transportation where they can get to and from physical therapy. We talk about their home safety. We talk about their stairs, their railings, and anything that may be difficult for them.
So when you actually prepare people for surgery, so you do the classes, you do a lot of education, what about their physical condition, or if they may be overweight, or what other resources do you bring into the picture to make sure that they're really ready?
Yeah, so we do partner up with lifestyle medicine because this is a very important topic. Anybody whose weight is not within a safe range, if their diabetes are out of control, so their hemoglobin A1Cs are over 7, or if they're a current smoker, these different factors put patients at a much higher risk of developing wound infections afterwards and other complications along with their surgery. So we do discuss that even before we set them up with a surgical date. We talk with lifestyle medicine. We give them the tools that they need to help lose weight, to help stop smoking, and to lower their hemoglobin A1Cs, just to make the whole process safer for them in the end.
So the better they're prepared up front,
absolutely,
then how does that change the outcome for the patient? What are you seeing?
They know what to expect. They have a contact person if they have questions. Just the more preparation ahead of time is the better people are going to do after surgery.
So with that, so you're coming to the surgeon, they hook up with you, you do the education. How long does it take between the time the surgeon says that you need to have a total joint? What is the reasonable time to expect of when you might have that surgery?
It could be a little bit different for everybody, but in general, it could be 3 to 4 months, depending on if we need to work on stopping smoking, if we need to work on your diabetes, and really how much pain that you're in. We do try to accommodate around people's schedules. Some people don't want to have it in the fall, the winter, because of the snow. So we do try to work with them, but in general, it could be 3 to 4 months before you're ready for your surgery.
And so you mentioned smoking or my weight. What does that have to do with how well I do?
So those are different factors that will affect your new joint replacement on wear and tear. So if you're very, very heavy, it could wear out your joint sooner, and then you would require another surgery sooner down the road. Okay. Smoking will help. That does cause delayed wound healing, which could put you at a higher risk of developing an infection.
Interesting. It's when folks are probably feeling the pain, they're feeling it's time to go have something fixed, and these other kind of lifestyle factors is what you're really talking about.
Yes.
Our behaviors, our choices.
Absolutely.
You're trying to help them for a longer term success.
Correct.
With their life and their movement. I'm assuming when you have a total joint, you need to get up and moving. So
Correct.
Talk a little bit about, I've had my surgery and I'm only there for one day, now what?
Absolutely. So we do, send everybody to outpatient physical therapy as our first choice after discharge. And we have a really good program actually even before surgery. So if it's called our prehab. So we do get everybody prehab. So we try to get everybody into physical therapy for at least one visit before surgery to start working on exercises that they should be working on between the time in the office and the time of their surgery. And that just gets them stronger and much better for recovery after surgery. After surgery, we do get them to physical therapy, and usually that's twice a week for the first 4 weeks, and then once a week.
Interesting. So outpatient physical therapy. Now, what about home health or skilled facilities? How does that play into the care of the patient?
If we are able to get patients to their own home and that they have a good support system, but maybe they're not able to get in and out of the car safely, we will pull in home health. We have a very good relationship with Franklin County Home Health and the Visiting Nurse Association. And they will come in and they'll see the patients until they're able to start transitioning to outpatient physical therapy. Usually that's around when the patient's able to start driving on their own again. Rehabilitation centers, usually we do not plan on patients going to rehab anymore because they honestly don't qualify for rehab. They're moving around so well that they're able to go home. So we've had a significant decline in the patients that have required to go home. And the other thing is that patients want to be at their own home. They want to heal at home. So that is our first goal is to work with the patient on what's going to be the best and safest situation for them.
So how do you think your role, because this is sort of a new concept for us,
yes.
And so how has your role made those changes possible and not having to go to rehab? It sounds like you're really focusing on the home. So how has your role made a difference in this course of care for the total joint patient?
Just so the education beforehand and making sure that the home preparation is all set will help. And then also I keep in close contact with patients for the first couple of weeks after their surgery.
Okay.
So there's always a couple of phone calls that are made. The other thing that they're able to do, if they have a concern or a question, they can always come into the office for a nurse visit. They don't need to go to the emergency department. They don't need to schedule an appointment with the surgeon to come in, because I am their contact, that they can come in and see me, and if we need to pull in a provider, we can. So there's a lot of close communication after surgery as well to make sure that they don't just go home and then nobody speaks with them again.
Right, right. So do you have any stories about a patient that you've helped? We won't use any names, of course, but that someone that sticks out in your mind that you've helped, and how that journey has made a difference for the patient, for a nurse navigator?
Yes. So the patients are very, very appreciative. A lot of patients have severe, severe pain and they can't move around. I do have a young lady who I actually saw yesterday in the office. We've replaced both of her hips in the last 6 months.
Oh my gosh.
Yeah. So
wow.
She's been in severe, severe pain, not able to work. And so the first time I met her, she was pretty angry and she was pretty upset and in pain. And she has multiple times on the phone, thank you so much for helping me get to where I am. Do you want to see me walk, is what she told me yesterday. And she got up and did a wonderful job. And she just said, my pain is so much better. So patients are really appreciative, and it's very rewarding to be able to help them out that way.
Yeah, that's really amazing. So where do you see this going? Do you have other plans or visions or things you're working on to continue to advance the role of the nurse navigator?
Yes, actually one of our big things that we are hoping to do is become certified, get the hospital certified for total knee and total hip replacements.
Wow.
So I just went to a conference in Chicago on this, and essentially this is through the Joint Commission Accreditation Center, and this is going to really make sure that we are doing all the right things for our patients.
Wow. This is amazing. It's really been an incredible progression.
Yes.
Of what's happening. So you're in a new space?
We are. Yes, we're now in our new medical.
How's that working for you and for the patients, actually?
Yeah. So we are in our new medical office building, and there's a lot of access to us. It's right up in the hospital, right in the very front of the entrance, so people are easily able to find us. So we've been there for about 2 weeks now, and it's going well.
Great.
Yep.
So you're feeling this integration. That was what the whole idea was to really be able to have. It's a busy place. You got orthopedics in there, you got primary care, and you got urgent care right up at the front. And
a lot of our patients that we do see in the office, they need to have labs afterwards. So it's very nice and convenient that we're able to send them right to our outpatient lab directly.
That's terrific. So I might have missed some things. I mean, we've been talking and our time is getting close to ending. Is there anything that I've missed or anything you'd like to tell the community about either the nurse patient navigator role or the Orthopedic and Rehabilitation Center?
I think we've pretty much covered a lot of it.
Okay, fantastic.
Yeah.
Well, you've been a wonderful guest, and obviously you're extremely knowledgeable about this and very passionate. And it's been amazing. I remember when you were with the nurse on Med-Surg and the charge nurse, and then you went to orthopedics. I'm like, oh no, don't go, because you've been so wonderful, in leading and teaching other nurses on the floor. And now you're really, creating something new that's impactful for our patients and making sure we're continuing to advance the patient experience and the patient's outcomes.
Yes.
So, and orthopedics is a real big deal. All of us baby boomers want to have things fixed. So,
yes.
So thank you for being there.
Oh, well, thank you.
That's terrific. So, and thanks for being a guest today. So my name is Jill Bowen, CEO of Northwestern Medical Center, and it's been wonderful to host this Health Beat show and to really learn how the nurse Navigator can be so instrumental in keeping you well informed and well prepared for your surgery and successful outcomes and more rehab at home, really getting back to your home. So thank you for joining us today.